Welcome back! I will now be going over your post-op spay and neuter discharge instructions. Please follow along with the printed version in front of you and initial on every line next to each paragraph as I go through your instructions point by point. And don't worry, you do not need to memorize all these discharge instructions right now. You do get a copy to take home in your take-home baggie. Your pet was under anesthesia today. Give them time to metabolize all lingering anesthetic drugs and feel better. Put them in a quiet place and let them acclimate again to their home. We recommend giving them time to rest today, away from other pets. If your cat had surgery, put them in a dark, quiet corner of your house, like a bathroom or a small room, with their carrier open and let them come out on their own. Depending on the size of cat carriers, they will not always have their e-collars or cones on them. Please put their cones on after they leave their carriers. Lastly, your pet might have a bandage on their arm where the IV catheter was. Make sure to remove all bandages an hour after pickup. Please wait to offer any food or water 2 to 3 hours after the time of pickup. Also, only offer about a third of the amount of food that you would usually feed. If you feed too early or too much tonight, your pet may vomit. They are still coming off their anesthesia and may be nauseous, so it could be normal if they do not want to eat at all today. However, do try to entice them to eat something yummy, like wet food, so you can coat their stomach and give them their first dose of medication today. Your client service representative will go over the dosage of the medication with you after this video, and instructions on dosing are located on the drug label. You can return to the normal feeding schedule and amount as soon as next morning. The first enemy of incision sites is moisture and licking. Please make sure that your pet is wearing a hard plastic cone for 2 weeks following today's surgery. Having your pet wear an e-collar is important to prevent your pet from licking and chewing at the surgical site. Without an e-collar, your pet may cause the incision site to become infected and/or open up. This may require additional surgery to repair the incision. Additionally, make sure other pets at home are separated from your pet as well, as animals are known to lick each other's wounds. Please note, our doctors do not recommend the use of soft donut cones, as pets are flexible and can sometimes still reach the incision site while wearing these. The use of a surgical suit is also not recommended, as pets can still lick through cloth and sometimes these suits rub up on the incision site and cause irritation, which could lead to infection. Overall, be mindful of the incision site and make sure that you're watching your pet closely to assure that they are not getting to the incision site and that the cone they are wearing is effective enough to keep them away from it. If your pet keeps taking the cone off, you can utilize their very own collars to loop through the loops on your e-collar so the cone is more secure. The second enemy of incision sites is activity. Make sure your pet is resting for 2 weeks after today's procedure. Do not allow your pet to jump, run, or play. We recommend keeping other pets away while your pet is recovering from surgery. If recommended by the veterinarian, prescription-strength sedatives may help facilitate rest. Another way to make sure that your pet is not active is to minimize the space that they occupy, like a kennel or a small room. No playing or strenuous activity is recommended, but light leash walks for potty breaks outside are fine. Any excessive stretching of the surgical incision may cause the sutures to break apart or cause the incision to bleed. Our doctors recommend icing the incision site for about 10 to 15 minutes a day every 6 to 8 hours for the next 2 to 3 days after today's procedure. You can start this today to help with inflammation. Make sure you are wrapping the ice pack in a towel to ensure that there is no direct contact with the skin. If ice is placed directly on the skin without a protective layer, this can irritate the skin or cause tissue damage. The incision site should always stay dry, so make sure you are not bathing your pet or letting them swim for the next 2 weeks. If icing the incision is causing too much stress for you or your pet, do not force it. The activity may do more damage than the actual benefits of icing at that point, so only ice the incision site if they will let you. You do not need to come back for a suture removal. We use internal sutures that are dissolvable, yay! But that's another reason to keep that incision site dry. Moisture is a breeding ground for bacteria and it slows down the healing process. We also use tissue glue for the skin layer. Tissue glue can dissolve if wet. It is your responsibility to watch out for your pet after today's surgery. They are in your hands now, so make sure you monitor the incision site every day for any signs of infection. What does infection look like? You may see excessive swelling, redness, foul odor, or seepage of blood or other fluids from the incision. However, a small amount of blood may seep from the incision in the first 24 hours after surgery. The incision should be clean and skin edges closed. There will normally be some red/pink color to the skin and/or some bruising around the surgical site. If you see any signs of infection, please give us a call or email us a couple good photos of the incision site. We offer free rechecks for 2 weeks after the procedure. Let us know what is going on and we will give you a good time to come in for a recheck. This is typically any Wednesday through Friday between 12 and 3 p.m. at the North Park location or between 12 and 3 on Saturdays and Sundays at the Escondido location. Any additional medications and procedures are subject to additional charges. Only come in for a recheck if you are concerned about your pet's incision site. Listed is our phone number and email. We are here for you. Do not hesitate to reach out to us and let us know what's going on. If you can't reach us by phone, we urge you to email us and let us know what's going on. Sometimes we are very busy. You play a vital role in the success of the surgery and recovery of your pet. We recommend that you, 1, monitor the incision site, making sure that it stays clean and dry. 2, making sure your pet or other pets do not lick or irritate the incision site. And 3, we recommend making sure your pet is not too active. Remember, you are responsible for all costs if any procedures or medications are required to repair the incision site. We have listed a number of urgent care hospitals in your area. If it is after hours at our clinic, or if it's a day that we are closed, Mondays or Tuesdays, please call an urgent care to get further assistance and advice. Please sign the bottom of your discharge instructions and make sure you have initialed every single line next to each point that I've gone over. If you have any questions at all, please reach out to a client care representative. I will let them go ahead and take over to go over your medications. Happy recovery!